Welcome to our channel, J&J House Call. My name is Dr. John Lucy. I practice integrated medicine and pain management in Jefferson City, Missouri. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. We are so glad to be back with you. We took a 2-week break, Memorial Day, and then we had a lot of things happening in our nation and in the country and the world. We hope you're safe and you're healthy. Today's topic is going to be about Echinacea. It's a great plant. We're going to go through the history, which kind of helps you to remember how and why we use the plant, as well as maybe why you should not use the plant, and so you know if it's safe for you or your loved ones to use it. And we'll also talk about whether it's safe for use during pregnancy. If you have not subscribed, please go ahead and do so, and always hit that notification bell so you know when we've uploaded our next video.
Let's get started. Echinacea, for those that are not familiar with it, is known as a North American coneflower. It's actually in the same family as daisies, and it's been around for centuries, and people have used it for treating coughs, fevers, colds, even typhoid fever, meningitis, and even septicemia. Now, of course, we have better drugs to treat those conditions now, but in the past, those things, Echinacea was used for that because it was found that it had some antimicrobial properties, as well as and boosted your immune system and helped with wound healing. So it's very interesting. And in the past, nobody really knew what the active ingredients of the Echinacea was, and that was actually providing the benefit. In the 1950s, there was a big push to figure out what was in each of these plants that was providing the benefit. Unfortunately, when they did the study, they used different species in different parts of the plant, so there's really no conclusive evidence to figure out all the different components of Echinacea. One of the compounds that they found was something called cychloric acid, which is found in the Echinacea purpura plant. And what they found that it had antibiotic activities as well as anti-hyaluronidase activity. Anti-hyaluronidase activity aids in wound healing. So that particular chemical is actually effective for that. And this another one that they found was something called alkylamides, which when you taste it, if you taste a good quality product, Echinacea in a tea or what is called a tincture, it'll feel like a tingling sensation. You even have a local anesthetic effect. This usually indicates it's a high quality product, and people use it in the past for tooth pain. The other thing it has is something called polysaccharides, which also help with your immune function as well. So it's got a lot of interesting properties and an interesting type of chemicals that are in it. One of the things it does stimulate is something called the CB2 receptor, which interestingly enough also is stimulated by marijuana, which it maybe actually add to the anti-anxiety properties of it, as well as some of the pain relieving factors in it as well. So the medicinal factors with Echinacea typically involve it stimulates the immune system, it's antimicrobial, anti-inflammatory, and also helps with anxiety.
And there's 2 types of Echinacea. There's actually 3 species. The 2 that he's mentioning is Echinacea purpura and then Echinacea angustifolia. And so keep that in mind as he talks about the rest of the history about this plant.
So one of the questions you can ask yourself is Echinacea safe? From what we've been able to find out, it's very well tolerated. Really short-term uses, it's really recommended use up to 7 days. And they found that it's even safe in women that are pregnant in all trimesters, as long as it's only used for 7 days. There's been no evidence that it affects the baby. And there have also been isolated reports that people have severe allergic reactions to Echinacea.
The plant, if you remember, comes from the daisy family. If you have any allergies to the following plants, you should use this with caution, such as ragweed, chrysanthemums, marigolds, and daisies. So
people that have a lot of allergies are actually at increased risk of developing some type of reaction or sensitivity to Echinacea, so keep that in mind. They also found that about 7% of children who take this do experience a rash. And also, it does inhibit a certain enzyme that breaks down certain drugs in our system. So you got to be careful when you're taking things such as Tylenol, amitriptyline, Valium, estradiol, propranolol, and warfarin or Coumadin.
Another group of people that should not use Echinacea are those that are undergoing chemotherapy, because the Echinacea may not let the chemotherapy work as effectively on your cancer.
The uses for Echinacea are typically recommended for decreasing the duration of the cold. Now realize that when you take it, it's only going to decrease the duration by 10%.
And if you're going to use it, make sure you use the species Echinacea purpura. It has the most clinical evidence for efficacy.
Yeah. So the next question is, should you be taking it to prevent upper respiratory infections? So none of the evidence shows that that's true. So you'd almost have to take it for 2 years straight to prevent one cold. If you had like 4 colds a year, you'd have to be taking it 2 years to prevent that one cold.
So we should only be using it to shorten the duration.
Correct. That's where most of the evidence shows that it's effective.
And make sure you start it within the first 24 to 48 hours, or else after that it's really not effective.
Yeah. And only limited to 7 days of use. Now the next thing that's been used for is with treating anxiety. Now one study showed where they took 2 different dosages of Echinacea, 20 and 40 milligrams in a tablet form. And then they showed that when, after taking 3 days of the higher dose, the 40 milligrams, the anxiety scores of the patients got better. So it has been shown to be effective. The lower dose was not effective. So if you're treating it using it for anxiety, you have to use at least 40 milligrams a day.
Basically, the summary is, before you run out and get Echinacea, make sure that you are not using it to prevent colds. Number 2, make sure you are not actively undergoing chemotherapy treatment for cancer, and that you don't have any allergies to the daisy family of plants. And if you're pregnant, it is safe to use it, but only for 7 days. And if you're going to use it to decrease the duration of the cold, you have to start it right away within the first 24 to 48 hours. It'll cut it down by 10%, the duration of the cold, and only use it for a maximum of 7 days. If you're one of those that's safe to use it, go ahead and just keep a bottle in your house, so if it's on the weekend, you don't have to worry about trying to find some.
Well, that's it for today. Thank you all for joining us. Our midweek check-in is going to be on the benefits of cacao. That's it for today. You guys have a great Sunday. So long.